by the time I was 16, I couldn't walk anymore because my injuries were too pronounced. And what I do is support people. And you don't do Pilates to look cute on a photo. Doesn't mean you're weak. Just know that you're worth it. You deserve it.
I'm here today with Marianne Tefani, founder of Core Connect. We talk about healing from injury, understanding your core, and building strength for life. Welcome to another episode of the Health Movement Podcast. Welcome, everybody, to another episode of the Health Movement Podcast. I'm Derek, your host, teacher of over 20 years and a certified personal trainer. Before I introduce our awesome guest from across the globe, I want to reiterate that we're not doctors. Before you go changing any programming, nutrition, anything like that, please consult with your physician. And if you find value in this show, please subscribe and comment and reach out however you would like. So, now that that's all out of the way, with us today is Marianne Tefani, the founder of Core Connect, a clinical Pilates educator, prenatal specialist, and women's health advocate based in Dubai. Marianne, is all that accurate?
Yes, it is. Thank you,
And
Derek.
I cut out all the stuff that you guys didn't hear, but I messed up that intro so many times.
Yes, I wish we could keep that on.
No, maybe we'll keep some of it, but I have to censor out some of the words. I am an elementary school teacher, so I can't leave those in. Marianne, thank you so much for joining us today.
Oh, thank you so much for having me, Derek.
Can you give us some background into how you got started?
So I actually worked in politics before, and especially health policy. I don't think you knew that.
I did not know
nice
that.
tangent. But I also was a gymnast as a kid. And so I guess what's got me started is that by the time I was 16, I couldn't walk anymore because my injuries were too pronounced, but no one could help me because I had nothing life-threatening. And fast forward a few years later, I'm in London, I'm studying politics and economics, and I go and sign up at a gym, and, I'm a student, so they make it very cheap. And I take my first Pilates class. And for the first time, I think the gym is a great environment because it helps you control and prep for things outdoors. So I grew up in the south of France. So everything we did was pretty much hike, play volleyball on the beach, very, very active outdoorsy lifestyle. But then after all these injuries in rhythmic gymnastics, I just simply couldn't do anything that wasn't controlled because then I would be in pain for days. And so that first class was the first time I realized there was something I could do to rebuild and support myself really and be able to move the way I wanted to move because I had been used to being a great mover. It was a big part of my identity. And then Pilates saved me both physically and mentally on multiple occasions, which means that when my husband and I moved to Dubai in 2015 and I left at the time I had a job at the parliament in France, I knew I wouldn't be working in politics because this is not a democratic regime. So there was no room for that here. Yeah. And I also knew I actually didn't want to work in politics anymore because I had been quite disillusioned with my ability to create any sort of impact, at least not with the state of institutions at this point. And that's when I was looking for a job and I started going to classes because it was a big part of my life. And I saw an ad for a teacher training, and my husband and I had actually a huge fight about it when I put down the deposit because we were, when you move to Dubai in the beginning, you think you're making a lot, but you realize that life is extremely expensive, and we were young and I had no income, so we had, I think, the first big fight of our relationship then. And then he came to his senses and he was like, you know what, let's see where this goes. Because you've always been... I love the way you phrase that.
He came to his senses.
No, but I was, like I'm telling you, newlyweds, bubble. So I was very surprised. Because he was like, Leia, I'm killing myself in the corporate world and you're there cooking and, just doing your little Pilates. And I was like, this is more to me. And also I can't find a job now. It was Ramadan. So I was like, it was dead back then during Ramadan. There was no way you could find a job. And it was June. So I knew the whole summer was ahead of me. So I was like, I might as well learn things. I have been working my whole life. I have this time where I'm not making anything. I might as well learn. And very quickly, it became clear that I was extremely passionate about this because it had helped me, and I knew how many people, the potential it had of helping so many other people. So I gave it my all, and he told me, I'll support you for a year. If it doesn't work out, you're still young enough to find a corporate job. And it worked out. And a year later, I was pregnant and suffered more injuries through a difficult birth. And I guess that's
Um,
how I became the core queen. That's how I started specializing in pelvic floor and in deep abdominals and in that whole core canister that supports us and allows us to live functional and happy lives and to look good too.
yeah.
So, so yeah, that's how I came to do what I do.
That's a really, really inspiring story, and I
Thank you.
love the fact that you spent so much time, in politics and realized, first of all, moving, I imagine, from France to Dubai, was that because of, your husband's job, or what brought you guys there?
It was because of my husband's job. He had opportunities, but I'm always very honest about the fact that I wasn't making it there. Like
Mm,
I was a French people think they're quite revolutionary, but if I love my people with all due respect to their strengths and weaknesses, um, I think they're not the rebels they think they are,
yeah,
which means that in the way you get hired, there were a lot of blocks because I was not. So let's say I would apply for consultancies and consulting jobs, and it would go really well because I was not too yeah, I was smart, I was
yep,
saying the right things, I connected some dots, and but then as soon as it came down to personality, they could tell that I wouldn't be happy creating the same PowerPoints and over and over
yeah,
again. And again, no offense to people who do that and do it really
yeah,
well. It just I would always fail that part, which feels very personal because you're like, oh, what is wrong with me? Clearly it's the HR part that is not working. But eventually I came to thank these people inside because I was like, I would never have been happy with this little space for creativity, for agency, for, you know, building an impact as well.
yeah, for purpose.
So yeah, for purpose,
Yeah.
exactly.
And I
And
think I love that you said that there, the question of what is wrong with me, and
yeah,
there's nothing. Like,
yeah.
some people aren't wired to do certain things, and you need to find what you're passionate about, and I love that your passion's helping people, and you found what helped you, and then you turn that into a career to
Yeah.
help other people. I
And,
think
I
that's
often
the
get
best
told
way.
that oh, did you have to go to political school for this? And I'm like, if you think training people's bodies and getting people out of pain and giving them that very sense of self agency is not political, you're really not aware of the power dynamics that, revolve around training bodies. But
Could you
that,
go a little deeper into that?
mm, oh, yeah. So yeah, no one ever asks me, but yeah, of course. Um, I, I'll give you two examples, I guess. Like at the minute, the Pilates word is quite trendy, and so whether that's said or not, in some spaces they'll deny some people access because they're too old, and too old is in Dubai is if you're over 50. So there's
Oh,
ageism, there's racism, whether it's told or not. There's um and when you're a teacher, you know it. You're a teacher, right? The power dynamics work in your favor. So how you welcome people into a space is utterly political to me. But with bodies, it's even deeper because that's where people are most vulnerable. That's where they're afraid for their survival. That's where they feel judged for being rounder or too slim or too this or too that. And so I feel like that would be the first example, like the way some people tell me they're received when they try and make that effort to go into studios because they're not blonde, they don't have fake breasts, they are not a certain weight, really breaks my heart. So that's
mm,
first. And the other thing is in this region where I operate from, so in Dubai, there's not a lot of Emiratis. There's about 10% Emiratis. And there are a lot of Indians and Pakistani. there are also a lot of Arabs, and there's also at the minute, uh, so all the conflicts that we have in the region or in the extended region are reflected in a studio environment. So you've got Indians and Pakistani next
Oh,
to each other. You have at the moment it's extremely hard for Palestinians and Israeli, and it's always been hard, but it is particularly strongly felt in this region right now. And so to keep reminding people that people are not governments is quite a political stance that I've chosen
yeah.
to make in my studio. So I hope that
Yeah,
elaborates a bit on it.
I have I mean, I think this is probably my 95th episode that I've recorded, and I've never no one's ever brought up that aspect of coaching or teaching or just,
Oh,
that divide that might get between people who are all, they all have the same goal or roughly the same goal, but to let the political issues or
oh
the
no, it's deep.
issues of
And
nationality, like, get in the way.
but I think it's because here we're closer to these conflicts. So we see
Mm,
more things than you might see in America or
yeah,
even in Europe. Um, so to them, it's not a political issue. It's not a headline. It's intergenerational trauma.
yeah,
And
that's
that's
true.
stored in the body.
Yeah,
So it's going to resurface then. And I'm currently making choices that I wouldn't go online, you know, uh, about, but they are tricky. I could get, I could be told like you support this or you support that, and what I do is support people, and I don't think we can ever achieve peace if people are not in the same room. But that
yeah.
is again, that's a take, right?
Yeah, I love that. So how do you and if this isn't okay to ask, please just say it, but, how do you navigate that? How do you create a space where people try to leave those differences at the door? I imagine that's incredibly difficult.
Um, I think by modeling, just like anything else, if you model being able to sit and listen to someone whose opinion you really disagree with, and and if people know where your heart is and what you stand for, then it's easier to create that kind of space. So yeah, I'm a strong believer that you attract what you actually model. So whenever my mom tells me you have amazing friends, and I was always like, oh yeah, it's true, I'm very lucky. But then my friends are like, yeah, but you're an amazing friend,
I was gonna
And
say
so
that, yeah.
I think I wouldn't say it's easy. I recently had the number of fires I put out daily is quite. You would think again, you would think it's not a political place, but it really is. But I think I just try to be myself, and I try to um, honor what people are telling me. And when there's too much anger in them, and then when they can't, I'm like, I cannot believe how triggering this must be. I cannot imagine how triggering this must be for you because I'm not in your shoes. So I'm not going to tell you what to do. I'm just going to encourage you to keep your heart open. You don't know what this person thinks. You don't know what their reality is. Um, and the nationality is now everything,
Yeah.
right? As we well know.
Yeah. No, I think modeling is in just my opinion, the perfect way to do it. You can't tell
You're a
people
teacher
things.
as well.
Yeah.
It's the same
You
as a parent, as a teacher. That's why I always talk about my vulnerabilities. If I injure myself, I don't hide it. I always am like, yeah, I think just say things. There was a lady who wanted to open a studio with me at some point, and I knew she had pelvic floor concerns. She had some problems with incontinence, right? But
Yep.
on her page, on her Instagram page, this was never mentioned, and it could have been used to help others more. So I was like, I'm so sorry. I believe in what you do, but we're not aligned. Like, I will always be
Yeah.
the one talking about how my issues help others fare better with theirs.
Yeah.
So yeah.
So can you, the difficulties with getting people to get along, so to speak, aside,
Yeah.
what does a normal class look like for you? Or how do you navigate the different places
Levels.
everybody starts at? Yeah.
So it's interesting because we've been considering, like one of my clients suggested for my classes, which are the ones that are obviously, I'm more known than my teachers at the minute, so they're more full. Um, she suggested I start a short program if people have not done their postnatal recovery with me, because sometimes I have people who come 20 years after the postnatal program, and some will understand they need to do it because they've never reconnected with their core, but some will find it very hard and triggering to go back in these spaces. So I think we're going to start having these few sessions. Like, if you want to work with me, you need to start with this. And it doesn't have to be done with me, but I need to make sure you know how to regulate intra-abdominal pressure. So you know how to breathe a certain way to avoid damaging your core and to get the most out of your group sessions. But really, the way it started is because I had that postnatal course that was working so well. So my first 5 years, I was in a studio where there were only 3 people per class. So that allowed me to
Wow.
tailor. Um, I was very much underpaid, but I could tailor to everyone's needs, right?
Yes.
And it made me able, I mean, it gave me that ability with repeated exposure to just create a class design based on the 3 people I see come through the door. That is going to work for them, regardless of what they have. And so eventually that allowed me to do this for bigger groups. But I think it's really my postnatal course, the postnatal course I created after my son, my first son was born. That became my sort of signature course in Dubai. Um, and at first, I was not able to teach to that level of precision with a number of people. So as part of that program, to build it and to really make it work and impactful, I would give a first free
Oh
session,
no.
individual session, to make sure that they had that base. But then what became evident is that when people were doing this first, then they jumped into classes and they were empowered, and I could push them more. And that was my objective. So I don't, it's very hard for studios because they need to make money, right? And so they need to
Yeah.
fill up their classes. They can't be too demanding. But at the same time, quality and results are very important to us, which is why I, like today in the class, there was someone who is clearly 8 months postpartum, but she has not done anything. So she's not putting herself at risk by being in class, but she's not making the most of it. So I was like, I know it's hard. I know it's a bit weird. And if you don't want to do it, I will not force you. But these 2 weeks, 5 sessions could really help you make the most of your normal sessions. And I always recommend this course. And to be really honest with you, it's usually a course I do with men. They just don't know. It's they'll come to me for low back pain, but I will be doing very similar exercises to help them reconnect, to help them load, to help them, find specific points. So I don't know if that answers your question, but that's
Yeah.
that's how I
Yeah,
make
no,
it
that
work.
definitely does. That definitely does. Now, you mentioned lower back pain, and
Yeah.
I don't know if it's similar in Dubai, but America, a
Mm,
lot of the occupations require sitting at a desk for a
yeah.
long, extended period of time. What do you do, or what would you recommend to people who experience lower back pain? And again, I know this is a very general statement. It's not a specific to one individual.
Yeah, yeah, of course. Um, there are so many reasons for experiencing your lower back pain, and very often, I mean, not often, as you know, but we need to first rule out that this could not be cancer, that this could not be.
Yep.
But let's just say chronic occupation related lower back pain. I think we all know by now. It was the study was published 25 years ago, but that the biggest risk factor is job dissatisfaction. So there is for sure a relationship to the stress levels and how the nervous system operates and why people have it there in the specific area. It's probably because of that slouching, because of the lack of posture, um, muscles being as active as they should be, as reflexive as they should be. So I do very simple things, and I do some nerve flossing when it's clearly there's a bit of nerve compression, but I mostly lengthen and reconnect them to their breath and to their core, but not the core. And a lot of people think it's the six pack and it's the obliques, and it's
Yeah.
it's not at all what it is. The core are
No.
the deep stabilizing muscles that are supposed to operate reflexively. If someone punches you in the stomach tomorrow, as toddlers do. I have a 5-year-old.
Yes.
If your core is not working reflexively, your core muscles will go dull instead of going in and up to absorb shock and protect your organs. That's what we mean by the core, is that system that is supposed to operate on its own. You're not supposed to be thinking all day, let me hold my pee. It's supposed to be working on its own. And so I
Yeah.
think helping these muscles work reflexively again through nervous system regulation, breath work, deep abdominal activation, lengthening through the glutes. Again, like you said, it depends on who I have in front of me. But I've noticed that there are 5 exercises that work very well for everyone. And I start with that.
What are those 5?
But so not all of them are without machine. There's one on the machine.
Oh, okay.
So the deeper learning how to activate your deep abdominals properly through breath work and not to hold and not to bear down, and then loading with curl ups, but again, maintaining that deep abdominal support. And then all the side lying glutes on the reformer are very much both strengthening and lengthening. So they're pushing into a strap as they move forward and back or do some circles, and that creates a decompression around the QL and that whole lower back area, and also helps stabilize the SI, the sacroiliac joints. So it does create both more stability, strength, but also space, which is very often um, one reason why people have that one-sided pain. It's very often very,
Yeah.
very tight, a lot of tightness. So they think it's sciatica because effectively their sciatic nerve is irritated, but it's not irritated by a disc. It's irritated by muscle tightness.
Yeah.
And so I think that's where the whole MRI debate is. Like when people come to me with their MRIs, I'm like, don't tell me you have L4, L5. I've heard it before. And we all have L4, L5 slip discs, like you're not that special. But I just feel so sorry that that's what people are told, oh, get an MRI. And oh, you have this. Well, pain and structural damage are not always the same thing,
Yeah.
and they don't always work, as we both know. My sister has severe scoliosis. She's had two surgery that didn't work. They gave her a staph infection, so she had to take the rods out. She has a very bad Cobb angle of 72 degrees, which
Oh,
has been helped. Now she's down to, I would say, 55, but it's still a significant
yeah.
bummer. And for years, she had no pain, none whatsoever. So a twisted spine, slip disc, that's not where pain originates from.
If you're finding value in this conversation so far, please consider subscribing and sharing it with somebody else. That's the easiest way and free way to help support the channel. And now back to the show. Yeah, I've noticed, at least with myself and the injuries I've had, it usually comes from an imbalance of one side is too tight and the other side's not, so you don't have the strength. A lot of people from sitting down, they hunch their shoulders, the chest muscles
Yeah.
they get too
So
tight
tight, so
and
tight.
they're not, and that's really the issue, is the back is weak now.
Mm,
And there was, I forget who it was, but recommended doing twice as many back exercises as chest exercises to try to
yeah.
build that strength up
That's a big
to
problem with
even that
men.
out.
It's a huge problem with men, less so with women. With women, it's more like because of the weight when like women of reproductive age, because of the weight, the chest, the belly, and then carrying a baby. So for them, it's tightness that comes not from overuse and overtraining, but more from
Yeah.
just, adaptations. And I was on a podcast with Emily Little. I don't know if you've seen her work on LinkedIn.
No.
She's a researcher, and she recommends baby carrying, but on the back. And it makes so much sense that so many things that we think are normal and evidence-based are actually completely cultural, because we've stopped carrying babies on our back.
Oh,
But
that's right.
really, that's so
Okay.
important for women. And so I told her a lot of the work that I have to do in pregnancy, I probably wouldn't have to do so much if people were always carrying stuff on their backs, right? So for men, I think it's a bit different, because it's just that men want to have pecs. So they'll overtrain their pecs. And then they've got these massive upper trap, and then the mid back section is just completely. It's just like, hello, I'm here. So it's different, but again, we go back to culture and aesthetic rules and things that are not really about evidence, but that that are more about
No,
aesthetic preferences.
nobody asks a guy how many pull-ups can you do or how much weight can you do on a lat pull down. It's how much can you bench, and that's
100%.
what it comes
But that
down
says
to.
everything. It
Yeah,
says everything.
and then you
Um,
load the chest
and
up,
no
and
one asks you as a woman how much can you bench press.
yeah,
The other day, you're going to make fun of me. I'm quite new to strength training, and I've had nerve surgery on my foot in the process. So, and it's really not my preferred thing, but I'm really putting in the work. And I had a really bad pec injury free climbing when I was 20 that took me 10 years to recover from, because at
oh,
the time I didn't know what I know now.
yeah,
But the other day I had 20 kgs, and I felt like such a queen because my peg before couldn't tolerate that. And to be frank, most people I train cannot do that. So my
no,
coach can, but most women I know cannot.
no.
And then they're playing with their kids and they wonder why they're hurting themselves. Your kid is 20 kilo. You, you need to be able to do this in a controlled environment so you can do it outside. But I was like, why is no one else impressed with my,
I am impressed. I am
Don't
impressed.
mock me. Don't mock
I'm
me.
not mocking you. I like that you mentioned carrying the kids because I think a lot of people forget or what should be the real reason for exercise and working out is to be able
Exactly.
to live life the way we should. I had a guest on a few times actually, Sam
Yeah.
Coop, who works with women pre and postnatal. You'd actually probably get along really well with her.
Okay.
But
I'll look up.
she was saying one of the women that she was working with was an older woman. And she's like, all right, well, what are your goals? And she's like, I want to carry my groceries. Or no, it was kitty litter. She had cats and she wanted to be
Wow.
able to carry the whatever it was, 30-pound bag of kitty litter into the house.
But
And
that
it's
is a
like, all right,
pretty, yeah.
yeah, but if you have your goals set up for actual real life purposes, then you get those wins when they come and it just feels a little different.
I think I don't know about you. I don't know your story and I'd love to hear it. Maybe I'll have it.
Sure.
um, but when I was 16 and I couldn't walk and my friends had to push me in a trolley so I could go out with them and party with them.
Oh,
This was no, but as an athlete, imagine like it was
yeah.
my whole identity was wrapped, and also my me feeling safe meant going to train 3 hours a day. That was my safety net. That was how the bad thoughts came out, and
Uh,
and so I think the combination of having been through that and repeated chronic injuries that no one got, until I discovered mobility and more about the nervous system. I That and my dad was an addict. So my dad was a former athlete that became an addict. And to see someone suffer, you don't take your health for granted. You're like, oh gosh, yeah, walking at 16 is actually
yeah.
not a given, Being free of your movement, being free to carry is not a given. And then happened again after my first son was born with I suffered 4 injuries. So I if you never take it for granted, then you work on it. Then you know exactly why you're going to the gym or why you're doing Pilates. You don't do Pilates to look cute on a photo. You do Pilates so that you can still coordinate enough to not trip off a sidewalk. Like,
Yeah.
essentially, that's the truth. And so I guess what felt like a curse at the time, it was not easy to accept. Um, now I see as I turned 40 in a few months. I see as my biggest blessing in life because I've never taken any of that for granted.
That's good. That's good. And I wish I could say I never do, but
But that's
definitely
okay.
there are definitely times where I do. And I've mentioned it on here before a few times, but I have Achilles tendonitis that I will paint houses during the summer. And it was getting bad in the spring, and I play in an old man softball league, which I love. But
Yeah.
before I even started painting, I couldn't sprint anymore, and I
Wow.
ran track in college. I was a sprinter, So, while I was never the fastest, I was always fast, and to hit the ball and have to jog down to first base
Yeah.
was it it eats at you a little bit, and then to, like, painting over the summer, I could only paint till, like, 12 o'clock, maybe 1 before I
Yeah.
couldn't walk 'cause being on the ladder, your foot's stuck there, your Achilles is
Yeah.
tense, and then,
I know
it
it's a
goes up
lot of
into your
pressure.
calf, and it was brutal, and I just got back to playing basketball a couple weeks ago, and it
Mm.
wasn't like I'm not 100%, I'm not sprinting, but I'm at least, like, able to do stuff, but you definitely when you're healthy, you don't notice, "Oh, this feels good,
You
and this
forget.
feels good, and this feels good." It's once something hurts, you're like, "Oh, crap." Like,
Yeah.
that one
And I
really.
also think the good thing when you've had, by the way, this wasn't my first injury, but the one that made me stop gymnastics was triple tendonitis as well, and including Achilles. So, and the doctor scared me. She was like, if you continue to just ice and then compete, it's going to tear, and then you're going to be in a wheelchair. And so that's what led me to make the decision to stop. But I, um, I always say I'm trying to help people now when they're 40 and it's their first injury, let's say. I try to get them to see it with curiosity, the way every time I have an injury now, I'm like, oh, what can I learn? And
Yeah.
it's still frustrating, but what had I forgotten, or why did this happen, or what can I learn about the body? So of course it's my job to learn about the body, but so it makes it easier. But I think if you look at life this way, um, challenges are a bit more bearable. Otherwise, honestly, you just don't survive life.
You wallow in the negativity or the
Yeah.
thing that's wrong that's happening instead of, "Alright, why did it happen? What can I do? How
What
can
can I
I
learn?
prevent this in the future?" And, I mean, if you've got to accept the fact that life is full of failures,
Yeah.
and even if you do everything perfectly, something's not gonna go your way. So,
Yeah.
if you're right, if you look at it as a chance to learn and understand, you're not so much focused on the wallowing in misery of defeat, so to speak, but you can take it as, all right, good. I get to try and figure this out now. I get to figure
Yeah.
this out now." So it's
And
that piece
it
that,
might help me grow.
yeah, and that's, I mean, that is how you grow. You go
It
through
is how you
struggles,
grow.
you go through failures, you learn from it, and you get better. It's same thing with
But
building
I'm going to be
muscle.
asking you a question now.
Oh,
Are you
good.
spiritual?
Yes, I would say I wouldn't say I'm overly religious, but I would say,
No.
yeah,
But I think
spiritual.
it helps when you get injured. If you're spiritual, not because because you're growth oriented. You're like, oh, you know that your soul's mission is you're here to grow, to learn, to just evolve into um something else. So if you
Yeah,
have that belief, then you're not experiencing something. You're not a victim. You're just learning. You're just a
yeah.
student.
You're just on a path, and that's one of the things that's gonna help you learn. I try to tell my students this, and it's if you get everything right all the time, you're not challenging yourself, you're not learning anything new. You've gotta fail, you've gotta make mistakes, you've gotta I have a sign on the board that says, "How many times have you failed today?" And the kids will go up and they'll make tally marks, and
Oh, that's
we try
good.
to we just try to celebrate failing because that means you're pushing yourself, you're trying something new. Um,
Mhm.
so yeah, there was a book that it was my father's favorite book called Jonathan Livingston Seagull. I don't know if you've ever heard about it. You
Yeah,
have?
my mom, yeah, as a
You
kid.
really?
Yeah.
That's
But
awesome.
my mom gave it to me actually.
Really? That's
Yeah,
really cool.
it's something that we read in the French curriculum. Not all teachers
Oh, I
teach it,
didn't
but
realize that.
it's yeah.
Well, my grandmother, my father's mother was half French. Um,
There you
or
go.
no, she was fully French. My father's father was fully Irish. So that's probably
Nice.
where it came down to. But for anybody who doesn't know, it's a story of Jonathan Livingston Seagull's a seagull, and all the seagulls are just flying around the ocean trying to catch fish, and he's off by himself trying to see how fast he can fly, how high he can fly, and he's kind of ostracized by being different than everybody else until he
Mm.
gets visited by a seagull similar to him with those same goals who comes as a teacher and helps push him. And then Jonathan goes to a new level where everybody's flying like he wants to, and it progresses up until at the end, he's now returned back down to the regular seagull life and finds someone else like him that was really pushing themselves to fly and be faster and see what they're made of, and then he begins that journey for another one. But it's I love that story, and it just that's if you look at the challenges as ways to learn and kind of a path that you're on, it makes that a lot easier. So I think that's awesome. I've never, aside from like my family, I've never met anybody else who's even heard of the book. So I guess I have to
You know
speak to
what?
more people in the French curriculum.
You've yeah, I will read it again this month if I manage. I
Nice.
will try and make the time because I read it. I was young. I must have been 10, and I was a bookworm. But I would love to read it with
I
40 year
think it
old
only
eyes.
takes about an
Yeah,
hour,
yeah. It's
maybe
very
2
short.
at most. It's quick.
It's very short.
The copy I have, the pages are all fallen out, but I can see some of my father's notes in there, which he passed away when I was 11, so it's really kind
Sorry,
of, it's kind of a, way to stay connected
family.
there, so
Yeah.
yeah, I like pulling that up every now and then.
Yeah.
So what's something, if people wanna take something away,
Mm.
women experiencing the core issues, what's something that they can do, that's gonna help them out?
Oh, yeah. That's tough. One.
Fine, give me
um.
3, give me a few.
Okay. So, one thing they can do is visit a women's health physiotherapist. So, a women's health physiotherapist is someone who goes internally and checks what is going on, the asymmetries, the tightness. So, I'll see a lot of runners, who go for runs
Mm,
and who tell me they have this hip pain and but they've not had kids. So, why would they go for an internal? And because it's so taboo, people will forget that these muscles are part of your hip musculature. And if you have hip pain, you need to investigate all sources of pain,
yeah,
including tightness in your pelvic floor. There's so much stored trauma in the body, as we discussed, and it makes sense. So people get that this knot right here, right?
yeah,
Um, but it's of course it's linked to posture, but it's also linked to us, the startle reflex and being a bit defensive and just protecting yourself. And so similarly, a lot of women will hold tension in their pelvic floor, and they may not be weak; they may just be tight. But over time, tightness turns into weakness and into symptoms. So I guess one thing to remember is that if you're leaking, for instance, if you're having incontinence issues, doesn't mean you're weak. It happens to a lot of athletes. It could be that you're never relaxing these muscles completely. And this could affect your sex life, and this could affect your life as an athlete if you're an athlete, and this could affect your back pain and pelvic pain. I actually just really posted today about back pain and pelvic floor issues being connected very often. So I guess, yeah, seeing a women's health physio, a good one, who's going to potentially release tension there or work on scar tissue you may have, it's very important. The second thing is I would really invest in how to breathe when I load. So if you're going to do abs, don't do abs in a stupid way. Don't do abs that no, but especially as a woman postpartum, or even if you're 20 years postpartum, someone who's had children cannot afford to do abs the wrong way, meaning to create too much intra-abdominal pressure and bear down. I'm sure you know what it means, but just for the listeners, bearing down means that that pressure goes downwards. So as your pelvic floor is trying to lift and with your deep abs, your abs suddenly go in the opposite direction, and it's like a fight. And so that will
mm,
create a lot of problems for you, if not now, later on in life, because force has to dissipate and it could give you back pain. So, yeah, and a third thing will be to remind yourself that you matter. I think for women that's a very big part. It's not something, it's a mindset thing. It's a cultural thing too. It's like a fight that we can yeah, it's a fight every day with norms that we should self-sacrifice all the time. But I think that's a third thing that matters. And the first two, you're not only going to get to if you have time, if you know that dedicating time to this is actually going to serve your loved ones, it's going to serve your family, it's going to serve everyone you work with and for. But I think if you don't work on the third, you don't make time. You say, I don't have time.
Mm.
And time is about prioritization, right? It's not
Yeah.
about, and it's about having a partner potentially who allows you, who lets you go,
Yep.
and who is strong enough in the marriage and in their fatherhood, for instance, if they're men, to just give you that space. But I think, yeah, women's health physio for a checkup to see if there's tension, if the where the symptoms are coming from, deep abdominal and breathing, yeah, just learning how to regulate that pressure in the core canister, and that's what I specialize in. And then the third thing is just love yourself and spend time on your own, on yourself, and don't make it a to-do list. Just know that you're worth it. You deserve it.
Yeah. Oh, that's a tough thing for a lot of people to
It is. It is.
understand, and I don't know if you do, but I definitely have those times where you question it, and it's something,
Yeah.
that you just gotta be aware of and work on. Are there any daily practices, any habits that you have that you refuse to skip that help you s be in the place that you are now? Because you seem as a
Um,
successful, confident woman.
Oh, I'm successful, I'm confident, but I have my share of issues as well. I think it really depends on your on where life how life started for you. I did experience quite a lot of childhood trauma, so I did have to work on myself. But so for me, as soon as I stopped meditating, my sleep suffers a great deal. So for me,
Oh,
meditation is, and this is how I know that everything I've told you, I'm still learning. Because some days I'm like, I'm not as important as the business. I'm not as important as my kids. I'm not as important as this and that. And so as my employees. And then I suffer and they suffer anyway.
yeah.
So I think, yeah, meditation for me, daily movement. I'm not saying daily lifting, but I'm now, even if it means I have to work until midnight, I will not skip my gym sessions. I will not skip um, for me, it's reading as well. Reading is very important for me to feel,
Mm.
um, yeah, to feel connected to myself and to my imagination and creativity. So you have to find out what that is for you. But I would say not looking at your phone first thing in the morning, getting some
That can be
movement
tough.
done. Movement done. Not thinking movement is separate from your career. Not thinking movement is separate from you being a good mom. You cannot be a good mom if you can't carry luggage in the summer holiday because no one will help
Yes.
you.
Yeah.
No offense, but so you need to build up to that, and then finding your tribe, I think, is just key. If you
That's
don't,
huge.
so it's
I
not trying to always, talking about the seagull, the way you wear, it reminded me of how many people feel like they've got to be sheep, they've got to follow the rules and do exactly what others are doing. And if I had done that, I would not be an entrepreneur. I would not move. I would not be fit. I would not, I have a very specific parenting style. My kids go to British school. I'm very French, very, very Mediterranean as well. So you just have to figure out who your village is and be okay
yeah,
to let some people go, I think. Not always feeling like you've got to perform a certain way or be a certain way. Being a cool version of you, I think, is enough. But this takes a lot of work and being self-reflective and coaching and therapy potentially. So yeah, that for sure. For me, if you're asking me,
yeah.
the number two, like two things: therapy and movement. That's it.
I love it. I love it, and I think hitting on the tribe piece is huge,
Yeah,
because you're going to y the people you hang out with, you will start to
yeah.
mimic
And
them,
look like.
yeah, and if they don't align with who you feel you are, you'll start to morph into somebody else, but deep down, that's not really you, so that's gonna be very difficult.
Yeah,
And you mentioned something in your response about, I'm not more important than this, or I'm not more important than that, and I think one of the pieces people have so much trouble with is they're looking at things in terms of comparison,
yeah.
whereas if you value yourself, it's not devaluing somebody else, and that
I love
just
that.
makes it easier to think I can value them, I can value me, and it just I think if we can if we can change our view to that, it would help. Not easy,
Oh,
not easy all the time, but
not easy, but I do find that we go back to your point about what we discussed modeling. You can't
yeah,
model something that you're not. It's
yeah.
you cannot fake that. And
I
I think
have
as tell me.
sorry, it this this hit me hard, and I was like, you have those moments where you something happens or you do something, you act a certain way, and you're like, "Wow, that's not
Yeah,
me. I regret that." And I played football in high school and college, and coaches, they yell at you, they scream at you, they swear at you. That was just kind of the way it was. So I remember when I started coaching, somebody made a mistake on defense and pulled him out of the game, and I yelled at him.
mm,
And I immediately felt like that's not me. Like, I don't know why I did that. And then I had to apologize to the kid afterwards because that I was trying to mimic what I have seen all those years. And it just, I mean, the kid had gotten drilled. He knows he messed up. He doesn't need me coming down on him too. And he's not
yeah,
going to learn from that. And maybe
no,
everybody learns differently, but my approach from that day, I still remember the kid's name.
wow.
Um, and that was, gosh, 25 years ago now, maybe 2022, I don't know, but it still sticks with me, and it's like, stay who you are. You're gonna make
Mhm.
mistakes, but, stay on your path, but I still I still feel bad. I still feel
I
awful about that.
I once spoke with a psychologist who told me because I had screamed at my child, and I'm not gonna lie, I have two boys. I run a business. I do scream sometimes,
Yeah.
uh, more often than I would like. But he told me once because I was very pregnant during the pandemic with my second, and my firstborn had spilled tea over my computer. We had no money during the pandemic in Dubai. I don't know
Oh,
about you guys, but like studios closed. Luckily, my
I
husband kept his job, but it was within a week people lost jobs. So I'm assuming in America it was quite severe
it's
as well.
similar. As a
Yeah,
teacher, they still kept us,
yeah, they
but
kept
yeah,
you, but
no,
I feel like you
it was
saw in other people how
yes.
brutal it was. So we were going through this, and he just spilled tea over my computer, and so which meant I had to buy a new computer at a time I had no income and I was 35 weeks pregnant.
Uh,
Um, and just stressed, second baby on the way. You've not been home for months and you don't know how long it will be. And I screamed. And so at the time, a therapist had told me, but you repaired, right? And naturally, I had repaired. I had spoken to my child and been like, I'm so sorry. This is how I felt. This is what happened. It's no excuse.
yeah.
You shouldn't have done this. You should have told me, but it's no excuse. And this is it. And this is that. And I think I'm definitely not a perfect mom. And I scream more than I would like to, but I do a lot of repair, which our generation of parents, I don't know about your parents, but my parents, they were just so engrossed in their own thing and the way they themselves had been raised that there was no, to this day there's no repair, and and I think that can be you're right, that's like honoring who you are and honoring that sometimes you mess up, but also talking about it and having the being self-reflective is
And it's almost
it's
good to
everything.
mess up and show that piece to your kids if you're
Yeah,
gonna be reflective afterwards, and then, have that conversation so it shows them the power and importance of being reflective. I think
yeah,
that's incredible. Oh my gosh, I didn't realize we've
yeah,
been
you
on
have to go.
for 50 minutes. Yeah.
I know, I'm
Oh, I could
sorry.
talk to you for hours,
Me
Marianne.
too. We'll do it
Well,
again.
yes, I would love that. So
We'll
how can
analyze the videos.
people
Yeah.
yes, how can people, get in touch with you or reach out if they have any questions or
So
they just wanna
mostly
chat more?
on social, I can also share my email address with you if you want to put that
Yeah.
in. But I post every day on almost every day on LinkedIn. I think that's how we met.
Yep.
Mostly the themes we discussed, lower back pain. I'm trying to tap into a bit more pelvic floor talk, but LinkedIn tends to censor me. But I want to get there. I think it should be out there for working women and men. And then so that's Marianne Tefani, Tafani. And then on Instagram, I'm also quite present. It's Marianne.CoreConnect, Core Connect being our baby, which we hope to expand in the Middle East and beyond.
All right. Well, I will make
I'll
sure
send that
those
to
get
you.
in there. And I'm going to follow you on Instagram too, because I'll throw up some reels of this
Amazing.
afterwards. But thank you so much for taking the
No,
time.
thank you. That
Uh,
was wonderful. It was like a coffee with a friend.
yeah, I
That's
love it.
what
I
podcasts
love
should
it.
be like.
And thank you everyone for taking the time to listen. Please reach out to Marianne. As you can tell, she's an incredible woman. So thank you all, and we'll catch you in the next one. Thank you so much for taking the time to watch the show. I'm currently working with companies and businesses on. Thank you so much for taking the time to watch the show. I'm currently working with businesses on corporate wellness. So if you'd like me to come in and work with your staff to increase energy, production, and overall happiness, please reach out. I'm happy to help. Thank you and enjoy your day.